Bismillahirrahmanirrahim. Uh, Topic of today is water and electrolyte metabolism. Today we will discuss about the electrolyte balance. Electrolytes, they are defined as the chemical substances that contain positive and negative charge, and they are called cations and anion respectively when they are solved in waters. Now, electrolytes mainly perform four primary function in the body. They act as essential mineral. They maintain the osmosis of the body compartments by establishing osmotic pressure, and mainly they help in acid base maintenance balance of the body, and they carry out action potential production of action potential, and they perform neuromuscular, endocrine, and excretory system regulation function. And most important electrolytes of the body include sodium, potassium, chloride, calcium, and phosphate ion. Their quantity is expressed in milliequivalent per liter rather than milligrams. Now, composition of the electrolytes in the body fluids. Uh, this is the composition in plasma, interstitial, and intracellular fluid. Here you can see the composition of sodium, potassium, calcium, magnesium, chloride, bicarbonate, sulfur, hydrogen phosphate, organic anions, and proteins. Now, a little bit about the electrolytes. Their main functions, like sodium, it is most abundant extracellular cation, and it is involved in nerve impulse transmission and muscle contraction and creation of osmotic pressure. Chloride, it is also major extracellular anion, and it is involved in regulation of osmotic pressure and formation of HCl in the stomach, and its main process chloride shift in the blood. Then potassium, it is a main abundant cation of the intracellular fluid, and it is also involved in maintaining the osmotic balance, like sodium, and it is involved in nerve impulse transmission, muscle contraction, and regulating the pH of the body. Then calcium, this is most important ion of the body. Mainly, it is the ion of extracellular fluid, and it plays an important role for the bones and the teeth, and involves in the blood clotting function. It is involved in the neurotransmitter release, muscle tone, and excitability of the nervous and muscle tissues. Then HPO4, it is important intracellular anion, and it is also the major component of bone, teeth, and it is required for the synthesis of nucleic acid and ATP, and for the maintenance of the acid-base balance of the body. Electrolytes and water, they play their role together, and main function of the balance of the electrolyte is played by the kidneys of the human body. Then hormones, they also play an important role in the regulation of electrolytes and water. And in hormones, the main hormones that regulate the balance, that is production or synthesis or maintenance of the electrolytes and water, these includes aldosterone, parathyroid hormone, renin-angiotensin system, atrial natriuretic peptide, and antidiuretic hormone. In water balance, you have seen the function of antidiuretic hormone. Aldosterone is the hormone of the adrenal cortex, and its production causes the increase in sodium reabsorption and potassium secretion at the kidney tubules, then parathyroid hormone from the parathyroid gland, and calcitonin from the thyroid gland. They regulate the balance of calcium. Now, the main electrolytes that regulates the body fluids, these include sodium and potassium. And sodium and potassium regulation is done by the secretion of aldosterone from the adrenal glands. Potassium ion concentration, when it is increased in the body, then adrenal cortex is signaled, and there is production of aldosterone. When there is production of aldosterone, then renal tubules increases the resorption of potassium sodium ion and increases the secretion of potassium ion. Then sodium ions are conserved, that is, they are reabsorbed from the kidneys into the serum, and potassium ions are excreted. As well as calcitonin from the thyroid gland and parathyroid hormone from the parathyroid. These regulate the calcium ion concentration by increasing the activity in bone resorbing cells, which increases the concentration of both calcium and phosphate ion in the extracellular fluid. This hormone causes the increased absorption of calcium and increased excretion of phosphate from the kidney. Now, electrolyte intake and electrolyte output. Electrolytes, they are required in minimum or small amount, which is sufficient for the human body, and they are mainly obtained in response to the hunger and the thirst mechanism. If there is an electrolyte deficiency, then a person may experience salt craving. Then electrolyte output, that is how electrolyte are excreted or goes out from the body. They goes out like water through main three procedures: perspiration, feces, and urine. And greatest loss of the electrolyte from the body is mainly occurring from the kidneys. Also, like water, electrolyte quantities mainly loss mainly depend upon the temperature and exercise. That is, if human body is um, having an excess of temperature, or there is an excess of temperature in the region, then there will be a great loss of electrolytes through sweating and exercise. Again, like water balance, if there is high exercise, then there will be high excretion of the electrolytes. Now, here is the summary of different hormones that mainly work to maintain the electrolyte and water balance. Here you can see aldosterone. It is secreted from the adrenal cortex, and its action is to regulate the sodium potassium exchange and sodium hydrogen exchange. And it retains sodium and water. Then antidiuretic hormone, you have already studied the mechanism of antidiuretic hormone. uh, it is released from the posterior pituitary, and when it is released, it increases the water resorption by the renal tubules, and it retains water in the body. Then renin-angiotensin system, that we are going to discuss in next slide. It is released from the glomerular cells and it causes the production of angiotensin 2 in case of high blood pressure by vasoconstriction of the arterioles, and it stimulates the aldosterone production, and again they causes the retention of water and sodium. Then atrial natriuretic peptide, uh, it is released from the stimulation of atrial stretch receptors, and they inhibit the renin and aldosterone secretion. Now you can uh, see that if there is production of A and P, then there is inhibition of renin and aldosterone secretion. Then there will be no conservation of water or sodium. There will be excretion of sodium and water. Now this is the aldosterone renin-angiotensin system, which is working collectively uh, in case of low serum sodium, low blood pressure. There will be the production of renin, and the angiotensin in plasma, it is converted into angiotensin 1. Then angiotensin converting enzyme will convert angiotensin 1 into angiotensin 2, and in case of the production of angiotensin 2, uh, via vasoconstriction of atrial smooth muscle, there will be increase in of blood pressure of the body. And also angiotensin 2 affects the adrenal cortex. There is production of aldosterone, and there will be the process of sodium resorption. This is the mechanism of production of ANP. When there is increased blood volume or increased blood pressure, then there is stimulation of atrial stretch receptors, and there is production of atrial natriuretic peptide or ANP. It will inhibit the release of ADH. It will reduce the thirst, so there is decreased intake of water, and from the inhibition of ADH, there will be diuresis, that is increased output. There is no water conservation, and it also inhibits the release of aldosterone. And if there is no aldosterone, then there is decreases amount of sodium resorption and increase amount of sodium excretion. Thank you so much. If you have any question, then please let me know.